Hey, everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Happy New Year, I guess, because we have been off for some time. We took the holiday off. So, welcome back to our listeners. And Emina, nice to see you on the podcast. I know we've spoken, but let's make this an official kind of a real show thing. So, welcome back.
Thanks so much. Thanks to all of our listeners. Happy New Year. It is our first official opportunity to wish everybody a Happy New Year. We've been waiting for the excitement to begin, as it always does this time of year, around the announcement of the executive budget proposal. So I will let Sasha kind of outline what has been proposed and what we know so far. But everybody, keep in mind, this is just the beginning, right? The next few weeks and months are going to be, as they are every year, pretty exciting.
Okay, well, hold on, everybody, hold tight. So we're
Yes.
let's get going. I think Amina took it easy on me because there is not much related to home care. So I'm actually going to start with the big news right now. We are recording on the Friday, the 23rd of 2026. We have a winter advisory, winter storm warnings. All across the state, we are looking at 4 to 8 inches, all the way up to almost 2 feet of snow. Please kick in your emergency preparedness. We'll try to get this out. Maybe it gets up before, but you should be instituting or launching your emergency preparedness plans. The biggest issue, I think, is the ice, which could knock out power and the wind chill factor. So stay indoors if you can. Communicate with your patients and your staff on the necessary precautions to, one, keep themselves safe and their patients safe. And the agency owners and or operators need to uh, monitor the emails for communications that come from the Department of Health. If it does get bad, as it did during Sandy, there were calls during the event, and there were reports requested. So just make sure that you are on top of your emails as far as that's concerned. So, taking a step back to also, January 1, minimum wage went into effect. The rates went up last year, 19.10 per hour, 18.10. That's in the city in Westchester, and then the remainder of the state was 18.10 as of January 1, 2026, increased to 1965, and 1965 New York City, Long Island, Westchester, 1865 remainder of the state. Total compensation with wage parity for the areas affected, 2219. Total compensation, including wage parity, rises to 2219 in 2026. Wage parity being $2.54 NYC and $1.67 Nassau, Suffolk, and Westchester. So now let's get to the governor and her State of the State address, which occurred on January 13th, 2026, where the governor's address included a focus on aging initiatives, where she promised funding. Funding was outside of Medicaid, right? So we know that there were cuts at the federal level. So the state is looking for non-Medicaid funding. So that's where some of this expenditure is slated to come from. So the governor outlined continued investment in preventative non-medical services, administered through the State Office of Aging. There is that it shows support for in-home services like personal care, case management, meals, and transportation. Uh, Also, the address included supports for naturally occurring retirement communities, and the launch of capable community aging in place, advancing better living for elders. So again, there's a focus there, but still looking to cap Medicaid spending. So we'll talk about that a little bit further later. A week later, the governor issued or released the executive budget, which highlighted the escalation of Medicaid spending due to the growth of the NHTD program, nursing home transition diversion waiver, with this rise. This is a direct result in rising of the aging population, right? So we currently have 10,200 enrollees in the NHD program. This is well above the 9,400 enrollment cap the DOH uh, did project or put in place last year. So we do expect DOH to return to CMS to get an approval to increase the cap, but this is pointing in a bad direction for the future of the program. The one House bill will be coming out later in March, and we expect there to be some additional proposals that may impact home care. So we're just gonna sit tight on that, as Amina was suggesting at the beginning of the podcast. But let's why don't we take a breather, Amina? So what we'd like to get your input on. If I missed anything, please add that, and let's get your take on what we've talked about thus far.
So at a high level, there was nothing specific to home care. For example, there was not a proposal to impose a LICSA moratorium. There was not a proposal to formalize in law any of these administrative DALs that have been coming out, restricting agencies' ability to expand across the state into other regions, et cetera. None of that. What there was is a general overview of the Medicaid budget. The biggest issue and the unknown factor that is influencing the state's budget process is the anticipated federal cuts. So, across the following 10 years, because of the loss of the federal match, the state is anticipating losing about 150 million. And so, with that unknown and the cuts really starting this summer, and you may have heard from the big beautiful bill, right, that there are new conditions on even the current enrollees to continue on Medicaid. The state is trying to figure out how to bridge that ever increasing gap because they will not be able to rely on the federal match of the Medicaid uh, and Medicare, excuse me, funding to offset these expenses. So for the communities that you all serve. The governor presented what she thought was a balanced response to that significant anticipated loss of funding. What she did say that is relevant to home care is that the state has continued looking at other ways to reduce its spending and that to date 1.2 billion has been saved in the consolidation of the CDPAP program. So I know a number of clients and listeners are still watching the whole single FI transition and hoping for a day where the old CDPAP system is reinstated in some format and additional providers are allowed to come into the space. With such a federal pressure and cut on the horizon, and the state touting the success of the PPL program, I don't think that that is likely. Okay, so providers need to be creative and look for new revenue sources, maybe in other states or in New York in programs that have not traditionally been utilized. As Sasha mentioned, NHTD is already above capacity significantly. And as we've said on this podcast before, that is the next CDPAP program that the state will be looking to cut down because the growth of it and the cost of it is not sustainable. So do not put your eggs in that basket, folks. That would be a mistake. Learn from the CDPAP over reliance. Diversify, diversify.
And
Sasha, you look like
yeah, can I get you to add to your comments around CDPAP?
yeah.
And I believe your newsletter may have touched on it. The Brooklyn agencies that were, the two convictions or the guilty pleas for the $68 million of fraud in the Medicaid program, where both Wasef and Tao pled guilty to kickback schemes and illegal bribing for Medicaid enrollees to sign up both for the adult social days and the CDPAP, right? All wins, all point to wins that the governor can tout.
That's correct. Right. I mean, the regulators never liked the CDPAP program. They thought it was a fraud-ridden program. Sasha is referring to a news article that came out, I believe it was in the Post earlier this week, that just highlighted an investigation that has been pending a long time that resulted in the conviction of two individuals who were marketers, really, and maybe they had some equity, but the article mentions them as being marketers and engaging in a kickback scheme, which we all know very much about. They are not uncommon in the social adult daycare space. They were not uncommon in CDPAP, and I don't think they're uncommon in the Lexa space either. It is where patients or employees share in the per hour reimbursement for services. So whatever patient hours are billed, the aide or the patient benefits, as well as the marketer benefits and takes money out of that Medicaid rate, hourly rate, as their commission or fees, or what the government refers to as a kickback, because the patient or the aide or the marketer who brought the case in the first place believes that they have an ongoing duty or right to be paid out of that hourly rate, and that's not the case. That is not the case. So, yes, these programs, the programs that are provided in the community continue to grow because there is a need to provide community-based services, but the regulators still have a very old mindset. If the services are not provided somewhere in a facility-based setting where they can be seen and validated that way, they're suspicious of them. So it's not just the social adult days and CDPAP, it is all services where that are provided somewhat independently in the community outside of a more institutionalized setting. Those are always going to be suspicious and highly regulated. But you know what, Sasha, you and I know so many of these CDPAP and social adult daycare schemes, and how often do they actually get litigated and investigated? Not nearly the amount of times that they're actually happening. So, um, and I always have this conversation with my clients. Do you want to be that one case that gets caught? Right? If we want to talk about speculating the likelihood of getting caught on something, I can't give any level of certainty on that. I can just say that someone will get caught, and you don't want to be that one, that one case that makes it in the paper. Now, back to the budget. The governor is in a difficult spot. I don't know that she's the most effective governor so far. And it'll be interesting to see how she fares in the elections. She's got a really, it looks like a formidable few challengers. But you know what? She's a money-making machine. That she's a political machine. And so, as much as I am unhappy with the decisions that she's made so far, affecting the home care industry, she is in a difficult spot because of what's happening at the federal level, and some serious cuts will have to be made. Now, there was a commitment of about 700 million, I believe, that will be invested in the home care program and in the long-term care program out of the MLTC tax. And some of it is reoccurring revenue, others is new. So that is something that may have an impact. Now, the overall budget that she proposed is actually higher than last year. The overall Medicaid budget spending is higher by 4 billion this year than it was last year. It doesn't mean that this is gonna be finalized, but it is because the state will need to spend more to offset what it anticipates losing this year from the feds. The other thing I want to talk about is and this will become more evident a little bit later. The plans have been kind of really highlighting concerns with this. When we get to the detail of how much is going to be spent on home care versus CDPAP, with CDPAP basically being a single provider system at this point, the state has done some projections and budgeting long before the governor announced her budget. And the way that the state allocated its spending between traditional elixas and CDPAP, the state was intending on spending more on CDPAP, even though an underlying assumption has been wrong, which is the state anticipated that more people would move into CDPAP under PPL. And so the state budgeted spending more on personal care services under CDPAP. That didn't work out quite as the state planned. A lot of people transitioned over to the Lixas. I think a lot of people continued to transition over to the Lixas because PPL is a horrible provider. If you, and that's my opinion based on reading all of the complaints in the chats, and what seem to be violations of wage parity laws, wage and hour laws, timely payment laws, health assessment laws and requirements and deadlines. The state has misjudged how consumers would move over to the traditional Alexa model and how many PAs would convert to be HHAs so they continue providing services to these folks. I have yet to see whether that has been corrected in the Office of Health Insurance Planning projections, but uh, as of a few weeks ago, that was the concern of the MLTC and the Plan Association at the state level, calling out PPL for pushing policies that disproportionately allocate personal care funding to the CDPAP side versus where it is truly needed, which is the Lixa side. And beyond the state making the mistake of how many people are actually in each program, uh, PPL is claiming that they need more money, a higher reimbursement rate for their services, even though they don't have nearly the regulatory costs that Lixas do.
I don't know how it slipped into the reporting on PPL that both the New York Times and Cranes started referring to an $11 billion program. When this whole started, it was a $9 billion program. But the at the end of last year, they started referring to it as 11 billion. We found 1.2 billion in savings, but it went up by 2 billion from your original projections. So did we really find savings? If you changed the goalpost and then went back from the 11 million, yes, I guess you could find some savings. I don't know. I just don't want that to be to have slipped by without notice. I definitely noticed. The other side of it, where PPL was getting some pushback and some backlash over their health benefit. Everybody had this essential plan. They were with leading age. They've since cut ties with leading age and are moving from the essential plan to what they're calling a secure health plan, which is a bit more robust. I think that looks good on their end and will help keep them from unionizing. Not what 1199 wanted, but I think that's better for the workers. At least politically, they are positioning themselves well and giving the governor a story to tell. I did actually think she was in trouble with the election coming up. But astutely, you pointed out she has a big bag of money to spend. So also when it came to Mamdani when he was running, there was big opposition from her. And then since Mamdani's taken office, he had two big wins, right? One was that free childcare for all New Yorkers, and as well as the public bathrooms, right? He put out an RFP for public bathrooms in New York to, people don't have to buy a $9 latte to use the bathroom, right? That New Yorkers know, and even those who visit New York know how big of a deal that is. So Mamdani is winning on broken glass issues. That's what mayors win on, right? The whatever snow fell when he was in office, it was cleaned up well. The big storm is coming. That's how mayors win, right? But I live outside of New York City. I hear free childcare. My kids are old. I have one in college. But wow, that would have been awesome to have free childcare. So those outside of New York are going to look with a bit of jealousy at New York, especially if it's successful, right? If it fails, bad for him. But if it's successful, that's what gets him to the governor's office, right? So yes, he's contained now, right? If you understand politics, he is contained, but he can win on mayoral issues, and at minimum, the counties are immediately around New York, not Long Island. Long Island is a lost cause, but no, further north of the city, I think that puts him in the ball game. And there are enough progressives that will vote for him outside of the city, especially again if he's successful. So I'll leave it at that because I know our listeners aren't necessarily fans of the guy. I'm speaking purely politically, political moves. She's successful on her part. He's successful on his part, and we'll see what comes in the near future. Amina.
So the only other thing I would add about the budget is that there's two things really. The state under Hochul's executive budget would allocate resources without any spending to support the implementation of the Medicaid Enterprise Client Management System, which would include updates necessary to transition the administration of Medicaid eligibility decisions from DSSs to the state. So slowly, the local departments of social services are going to be removed from some of these Medicaid-related eligibility decisions. Although, under Trump's big beautiful bill, Medicaid eligibility will have to be proven by some folks, not all, tied to employment. And there's an 80-hour work requirement per month. I don't know who's going to do that in New York. Who will be verifying the employment status of these people who are looking to stay on Medicaid, except the DSSs, the local departments of social services. I had gone to a conference a few days ago in the city where this component of the federal bill was being, or law at this point, excuse me, was being discussed, and everybody, and it was a room of healthcare lawyers, everybody was dumbfounded as to how the state would actually operationalize this requirement. But there are efforts currently at the state level to remove some of these Medicaid eligibility decisions from the departments of social services. And then separately, the governor proposes to invest $11 million to establish a new CON online system. Again, this is not a single year investment, but the state is looking to create efficiencies and streamline the CON process. And then lastly, there is a $150,000 that the governor would allocate for additional staffing that would be required for the expansion of reporting requirements for healthcare entities involved in material transactions. If you remember, there was a law that was passed requiring, quote, material transactions that are not otherwise reported to be reported to the state. That particular law requiring the reporting of transactions that are usually not reported is actually very ambiguous. And so the governor proposes to add some more staffing to make sure that that is implemented. I mean, that's a pretty precise commitment on her part. We'll see if it passes. So Sasha, that is, I think, all that we have to report on the budget for the moment. What I'm interested in hearing about is your association's advocacy efforts and plans over the next several years as the budget season unfolds.
Great setup. One thing I before I touch on that is the Medicaid eligibility reporting, I'm probably going to have to speak with the bookkeeping company to see if they can submit that on our behalf, which would be awesome if we just automate that, and we'll put a call in. And maybe your booking keeping company does the same. If not, I can give you a recommendation. So we'll you message us or message me on LinkedIn if you need a recommendation there. Having said that, thank you again, Amina, for teeing up Fair Access Initiative. We are going to be in Albany February 3rd for our Advocacy Day. We already have meetings lined up with the legislators. We've been meeting with everybody from the governor's office to legislators virtually going to events in the community. We have some caucus events that are going to be happening in Albany. I will be traveling up for those as well. Some day trips, some overnight, and we actually have been speaking with some of the other associations and some of our initiatives they've signed on or are in support of. We support theirs. And then we have one of our initiatives on the home care ecosystem that we are working with them on revising, splitting up, and having a part A, part B, focusing on different things. Look, I think we are taking a different approach. This is a long-term effort. We appreciate everybody who's supporting us this far. If you have not, the fees are reasonable to join and support our efforts. You can go to fairaccess.org, fair-access.org. The white papers on our initiatives are on there. The one pages are there. You can always message me on LinkedIn or even through the Home Care Forum podcast page on LinkedIn, and we can connect that way. And I could share. Everybody is invited up to our uh, Advocacy Day. We are posting that on LinkedIn as well, information around that. And again, welcome everybody. Thank you for your support thus far. We've done a lot. I think we need to do more in telling that story. And we've been speaking to the team about that. Hey, we are doing the work that people expect us to do. We just need to make sure that they know that we are. So I will push and make sure the effort is there. And now that we're back on doing the podcast, I'll take every opportunity to do so. So thank you, Amina. I can close out.
Yep.
All right, great. Thank you everybody for listening. This has been the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Have a good one.